So we have with the 7 people live with us, so I think we should start. Hello, everyone. I hope all of you are staying safe at home, and especially you're safe from Corona. This live session is brought to you by the ambassadors of the Royal College of Surgeons of Edinburgh. As ambassadors, we represent the Royal College in our respective regions. I am Dr. Harris. I represent the Royal College in the Southeast Asia region that covers Pakistan, India, Bangladesh, some other countries. Dr. Mark represents the Royal College and I'm getting calls, sorry. Dr. Mark represents the Royal College and North Africa and Mediterranean region. And what countries do you cover, Dr. Mark?
Yeah, so half of the continent of Africa, like the upper half. So North Africa, it's like Egypt, Libya, Morocco, Tunisia, Algeria, Sudan, and then like the Mediterranean and like Palestine, Jordan, Iraq, Cyprus, Lebanon. Yeah.
Oh, and for those of you who don't know Dr. Mark, like he has been a member of the Royal College for the past 5 years. He's an amazing senior. He also teaches in British University in Egypt as a faculty member, and he's partner in a very reputed clinic in Egypt. And if any one of you is like looking for a dental treatment in Egypt, like he's the cosmetic dentist to go for. And most importantly, be aware of this guy because he might be your examiner one day.
Yeah, man.
But I'm not supposed to tell you when and which exam.
I hope that you might even like meet Harris as an examiner. He would be much better than me.
yeah. But we are not supposed to tell you what, when, where. But like, so Dr. Mark, what is Royal College? I'm pretty sure most of our followers, they're not aware of like what the Royal College is, what it does. And this session is more helpful for the international dentists who are looking to pursue their career in dentistry after BDS, or they're planning their careers in like post-graduation, private practice, practicing in their own countries, practicing in UK or Gulf. So to start off this session, first we will explain what the Royal College is. So,
so the Royal College is like, I hope that we have enough time to like say everything about the Royal College, but I think to be like short. But briefly, like it's like one of the oldest colleges in the whole world. 500 years ago, or more than 500 years ago, it was established, and it has like 25,000 members and fellows in the whole world, nationally and internationally.
And how to get its membership?
Okay, so to get to be a member in the Royal College, you have to pass one of its examinations. Like there are many exams. I don't know if you can start talking about the first exam, which is for the general dentists, the MFDS.
I'll talk about the MFDS. I'm getting a lot of questions on my live. So guys, let us explain what MFDS is, what Royal College is, and then at the end we will take all the questions because you keep asking questions and they keep going up, and I don't think most of these questions I can answer because I have some questions with me already. And when we're doing the question answer session, you can like keep asking the questions. The Royal College takes this MFDS exam for its membership. You are done with BDS, and now what is the reason that you would take MFDS? Why would you sit for MFDS? We have divided, like for our seminar, we have different reasons to do it. The first main reason, which both me and Mark agree with, is the training in our countries when we graduate and when we do like BDS. What we feel is we know operative dentistry, we know prosthodontics, we know surgery, but right after graduation, we are not like that good of a dentist. We don't know the basic guidelines to practice. We don't know how to like see a patient as a whole. And in terms of increasing that knowledge, in my opinion, this is the best investment that you can do. And I have many students and doctors ask me, like who are like starting their private practice, what equipment to invest in. And in my opinion, before investing in equipment, this is a very good exam to invest in. Second thing is, especially for the private practitioners, you don't have a support group. like for if someone's doing a post-graduation or specialization, you are affiliated with some college, some academy or some institute. For private practitioners who have nothing with them, no support, being a part of Royal College gives you that opportunity to be a part of a family. And it is like so friendly, one of the most friendly colleges in the world. And like what me and Mark, we call Edinburgh our second home because of the Royal College, because we have a place there where we feel at ease. And we know the college is there to support us no matter what. And in terms of our practice, in terms of our post-graduation, in terms of things that we want to do. Thirdly, post-graduation. Especially in the UK, it used to be essential, like an entry requirement. And right now it's desirable, but it is very hard, almost impossible to get into a post-graduation in the UK without MFDS. So if you plan to take this route where you want to do post-graduation from the UK, MFDS is one of the most important exams that you need to do. And I don't know anyone, I don't know if Mark knows anyone who has gotten into a good post-graduation in the UK without MFDS, because it's very competitive.
Yeah,
and
I agree with you, Alice, yeah.
Yeah, I don't think they allow it, right? It's not like formally written that it's written it's desirable, but still, like I think it's like a must to do for post graduation.
Yeah, we should say, like as you just said, it's a must to do, but it's not like one of the criteria that you be accepted for this.
Yeah, but I guess Natalie can throw some more light on it.
Yeah.
So, fourth thing is letters. You get to write MFDS RCS with your name. And especially for dentists in Pakistan and also I guess it's in Egypt too, when you have letters after your name and patients respect you, like they consider you something like out of this world. And I've been practicing for 5 years in a very good location, and trust me, MFDS has given me more patients than any other local degree. And like even like this is not something like, it's not a direct advantage, but it is an advantage. And if you're a private practitioner, you invest in things that give you better return. And for private practice, this gives you the best return with minimum investment, because a master's degree costs like 10 times more than MFDS. Also, as members, we have access to the library of the Royal College, which has almost all articles that there are in the world. If there is any article or book that we don't have access to, we can request the access and the Royal College provides this to us. Then there are member benefits like the discounts on hotels and things like that, courses, webinars. And the most important benefit, in my opinion, is like the knowledge that you get from the exam and the road to post-graduation that you get into, if you plan that. And for private practice, this is the best thing to do if you want to stay in Pakistan or Egypt for that reason, and you still want to stay relevant and stay up to date with the latest knowledge. MFDS is the way to go. The next part, what MFDS is, how to take it, what are its requirements. Mark, can you please throw some light on it?
Yeah, sure, Harris. Let me first add some like one of the more benefits of like there are many benefits for being a member in the Royal College. I just want to add a few things for what you just said. Okay, so in Egypt, or maybe like if you want to work in the Gulf area or Dubai or these countries, if you are applying for a general practitioner position, there are so many dentists are applying for this. But if you have an MFDS, this gives you a privilege, and they choose you before they choose the others. So it's an ad for your CV. Also, let me highlight the courses that you just mentioned on their website. Being a member, you have an access to an archive that have many online courses that have been held by the Royal College in many different specialties, like in endodontist, in surgery, in pedo. So they have many courses, and they're still adding more.
Sorry, I'm cutting you off. Like I have gotten very lucrative job opportunities in Dubai, and the people who applied for the same job with me, they had masters from India, from Pakistan, and from Yemen even, and they were like for the GP dentist position, and the employers, they considered me because of my CV, and MFDS has a lot to do with it. And what happens is, if you're looking for a GP dentist post, And especially I run private practice. I have like dentists coming to me for jobs all the time. And when I see the CV and they have MFDS or a good degree, because it's a certificate of excellence for a basic dentist, and it is preferred. And I actually got a job from a person who was like 10 years senior to me. He was 10 years in practice and he was an endodontist from Yemen. Only because of MFDS. This happened like last year in Dubai. So like it's fresh. It happens. It may not happen to you. I'm not going to guide you like it's going to give you a job. It's about luck. But having a good diploma with you is like important. And it opens so many roads.
So about the exam, it's two parts. You have to pass the first part, and then you are able to take the second one. The first part, you have to finish the bachelor degree. You don't have to finish the 1 year of the training after the bachelor. You just have to finish the bachelor degree, and it's like 200 MCQs, an exam of a written exam with 200 MCQs in 2 hours or 3 hours maybe, yeah. And the cost of it is around 500 sterling, roughly. It's according to which country you're taking the exam. So it depends. So this is the first part. The second part, you have to finish the bachelor.
So, brother, wait.
Yeah.
About the part one, how should I prepare it? Do we have like biochemistry questions?
No, this is the good thing.
Like Krebs cycle or like...
Yeah, so this is the good thing that in the MFDS exam preparation, you don't have to study all the basic sciences like the physiology, microbiology, biochemistry, all of this. You don't have to. Yeah, so you only study the applied clinical dentistry, like the things and the subject that you actually face in your clinic.
Okay.
Yeah, so it takes around, like, some people can prepare for the exam in 4 to 6 months. Others can take more of this time, but this is roughly the time you have to prepare for this exam. This is for part one. So for part two, it's much fun than part one.
Yeah, it's a fun exam.
Yeah, and I consider it one of the things that ever added to my self-investment. I consider this is like self-investment when you take part two, because you learn many skills and you have to. It's okay. Let me explain the exam. The exam is about 10 stations. It's called OSCE station. So each station is 10 minutes. You have to prepare 2 minutes and read the scenario, and 8 minutes in the station. So the station is about, you just have the scenario of the case, like let's say periodontal case, a patient who suffer from periodontitis or something like that, and you have his history, his medical history, his dental history in the 2 minutes to prepare for this, and they ask you to do actually what they want from this station, like if they want you to just gather some information or to give treatment options or to expose or say a bad like to handle a bad or an anxious patient.
Breaking bad news.
Yeah, and breaking the bad news. So after the 2 minutes, you enter the station. You have 8 minutes in front of an actor, someone who's acting as a patient, and he start to tell you what he's complaining of, and you start to ask the relevant questions and to explain the treatment options that you have for him. And then examiner who is just sitting and watching how you are interacting with the patient, because you are evaluated according to 4 domains. It's about like information gathering. How did you gather information from the patient? Are they relevant or not? The second domain is the dentist-patient interaction. How did you interact with the patient? Were you looking to him? Were you showing empathy with him? Or you just throwing some information to him and that's it? No, you have to be interactive. You have to have good communication. The third domain is communication, and how do you explain the scientific terminologies in a simple way. And the final thing is the core, the clinical management. How did you manage the case? How did you did you ask for the right investigations that you need, like more panoramic X-ray or some CBCs? Did you give him the right treatment options? Did you give him a proper treatment, like drugs or something, if you need like some mouthwashes or something like this? So this is like, you have to move around 10 stations in this way, and you preparing for this exam, you acquire many skills in communication and managing the patient, and taking all the subjects that you have been studying like separate subjects, but preparing for the MFDS part 2, you collect all this information and you handle the patient and give him a full and a whole treatment plan that might include many things like endo, perio, and you have to categorize your priorities and put some phases in your treatment and explain it to the patient. This is briefly.
Yeah, you have. It's a test, like if you are a dentist or not, like a qualified dentist, because in the exam, it's the easiest to prepare. There's no syllabus, like all of the dentistry is there, and the preparation part is like one of the best parts about the exam. Even for people who are like failing to pass this exam, only the preparation makes it worth it. Like just preparing the exam, they become better doctors by reading all the guidelines and stuff. But when you enter that OSCE station with the actor and the examiner, oh my God, those 10 minutes are the most crucial, because you have to diagnose, you have to like propose a treatment plan, and you have to do all this while being very empathic and very like supportive of the patient. So like they test your communication skills, they test you as a doctor, they test you like if you have the ability to differentially diagnose a disease and then propose a treatment plan which is best suited for the patient. So this is what MFDS part 2 is about. So are these exams difficult? How would you rate them, like on the difficulty index, part 1 and both part 2? Because I know for some reason you know some things about part 2, because we want to guide, because most of our audience is international, and most of us here are from Egypt, Pakistan and Iraq. So both 3 of these countries share similar problems in part 2 and part 1. So like how would you define the difficulty index that they would need, like for part 1 especially? It's like applied sciences. I don't think there's a lot that they can struggle in terms of like preparation and stuff.
Yeah. So so I guess I can say that part 1, you have to study. Like you have to study and take some knowledge from some books and gather all this information about ethics and professionalism and all this added subjects. So I don't think that part 1 is that hard. It's like you can like it's not that hard. Like 80 or 90% of the students can pass it easily. But part 2, you have to prepare very well, and studying part 1 in a good way and in a proper way will help you so much in preparing in part 2. So you just they are just in escalation. You have to take part 1 and you have to like study it, because some students might try to get the old questions and to study them and to pass, but then they are shocked in part 2 because they are not well prepared. So
you might know everything about dentistry for this exam, but if you're not able to perform it in front of an active patient, you won't be able to like pass this.
Exactly. So but part 2, you have to prepare well, you have to practice, you have to always have this mental capacity that you are ready to explain any of the terminologies in a simple way, because it will look funny if you're in the exam and you're trying to explain something in a simple way, but you didn't prepare for this. So you will waste a lot of time, you will get anxious, you will get worried, and you might have a mind block. So getting well prepared for part 2 is like it needs some practicing and some guidelines that we might talk later about this.
Because I'm getting so many questions. I've said this earlier. We are going to answer all the questions at the end of this whole session. We are going to give you some knowledge first. After that, we are going to take some questions because there are so many questions. I cannot answer each question without like detracking from the whole thing. So I have done MFDS part 1, part 2. What next? What is the advantage?
Okay.
Who is it for, man? What am I doing in the world now? MFDS is done.
Okay, it opens many chances for you, by the way. Like if you're a GP, you are ready, like after taking this MFDS exam, you are ready to practice or have your own practice confidently. Like you can feel it after you finish this exam, you can feel it. Like if you're like, weren't that confident, am I ready to start my own practice or not? After this exam, you will feel like I'm so ready for this. And if you're taking a postgraduate study, like either a master's degree, I will tell you something. Okay, let's postpone this later on.
Yeah, let me see if Natalie is here because we have done MFDS and all of us want to go to the UK. Let's say, for example, all of us are like going after London, and after Corona gets away from us, and let's see what options do we have. Let me see if Natalie is there. Natalie, are you here? Hello, Natalie.
Hi there.
So she is a Wonder Woman in dentistry. She is undergoing specialist training in special care dentistry. She's based in London, and she's also a blogger and influencer. And she's doing a lot of things. Like I cannot keep track of all the things that she's doing. So Natalie, say hi to all the 158 people watching you right now.
Oh wow, you have so many people. Hi guys.
Yeah.
Tuning in across the world. And how has it been so far? Has it been a useful session?
So we were discussing about the options in the UK after taking the MFDS. I have done MFDS. Now I'm struggling to get into UK. First of all, they would like to know this. MFDS is not the licensing exam. It's a membership exam. For licensing, they need ORE or LDS. But let's first talk about the postgraduate options. Like I have done MFDS. What can I do next?
So I guess if you want to start practicing in the UK, getting the ORE or the LDS is something that you need to start if you're working as a practitioner. But it doesn't stop necessarily you getting in UK graduate education-wise, doing further qualifications. So if you wanted to study in the UK as a UK student, under any of the postgraduate training programs, either which are different by the different universities, you don't have to be a GDC registrant to do that. You can work under the university's registration, or you'll be working in supervision. So you could do postgraduate qualifications at universities in the UK. There are 13 undergraduate dental schools in the UK, but there are plenty more that offer postgraduate dental degrees, from anything from diplomas, certificates, masters in clinical dentistry or research, or even PhDs. And that is a good way to gain qualifications in the UK, and you don't have to have set the ORE or the LDS to be able to do those qualifications.
Okay, so most of the questions were from people who were already done training in their countries, for example, Pakistan, India, Bangladesh, Egypt even. They have done either maxillofacial surgery, or some people like pediatric dentistry, and have people who have done ortho training, and now they want to practice as a specialist in the UK. And after having done like maxillofacial surgery, or I don't know if are maxillofacial surgeons allowed to practice in the UK with the single BDS degree?
No, so in the UK, if you want to be a maxillofacial surgeon, you will have to have done dental degree and also medical degree. I have a very close colleague who is on that pathway, and it's a 14-year training pathway to be able to be a consultant.
That's passion.
So you'd have to get. I know, it's very, very, very patient. I think they need a medal.
Yeah.
I think you need, if you're a qualified maxillofacial in another country, you need to also have done a medical degree in the UK to practice as a specialist. You could technically practice, but not as a specialist if you wanted to. like as a salaried job in a hospital. We call them like a staff grade, like a staff grade dentist or a house officer in that specialty. But you will not be recognised as a specialist because you can't register on the General Dental Council as a specialist.
Yeah, but you can do the membership in the oral maxillofacial surgery from the Royal College, which is going to be valid for the international community, but not in the UK.
I think, not in the UK, because what makes you basically what sets these requirements up is whatever our General Dental Council sets, in terms of you have to be registered as a specialist. And to be registered as a specialist, they will have for each specialty requirements to be able to call yourself a specialist, and that will be involved for maxillofacial surgery. It will be sitting in fellowship, but also have a degree, medical and a dental degree as well.
What about ortho? It's like membership in orthodontics, M-Orth exam, right? Yes,
M-Orth exam. That's fine. You can sit that. It's one of the colleges, and then you have to have then got the evidence of that you've had a training program of some sort. So usually it's like a 3 or 4 year, and that can be done. Doesn't have to be done in the UK, but if you've gone through a specialist training program and sit that, you can and sit the M-Orth, and that's how you get your fellowship.
What about pediatric dentistry and FFD RCS? Most of the people, because they want letters after their names, because like they have graduated, they have done the MFDS, now they have to put letters. I'm MFDS, FFD RCS, I'm MOMS, I am like things like that. So I need to put letters after my name. I've done 3 years training in like say ortho or say surgery, and I need FFD fellowship. So what is the best and easiest and quickest route to that?
I think it's making sure you fulfill the requirements to sit the exam, which is, as you say, is a specialist training, recognised. That's the thing, it needs to be recognised by the college as a training program. So by meaning, in terms of, I only know what we mean by that in the UK, but in the UK that means either it's funded, it's a recognised training program by our NHS, by our National Health Service, or it's a recognised training program through a university. And that's what it means by recognised, and then you can sit the exam. But I don't think sitting these exams is as straightforward as just sitting an exam. Certainly the equivalent exam in my specialty, in special care, there's a 50% fail rate. So they are difficult exams. And especially if you're sitting it in a college where and your training program isn't so familiar with it, it's worth going on these. The colleges do prepared courses to help you prepare to sit for the exam, which are really, really helpful, especially if you're not so familiar with the format of the exam and things like that, in terms of preparing you to where you need to work and your own knowledge to make sure you maximise the chance of actually passing that exam in the first place, and then you can get your fellowship. And they're not cheap either, so you want to make sure you pass them. You don't have to resit them a million times.
Yeah, but what if I have done M-Orth and I want to practice as a consultant in the UK? Do I still have to take ORE and LDS?
Yes. Yeah, you will
because
do.
Because I won't be registered with GDC without the ORE or LDS. So everyone who's looking to like enter the UK, ORE or LDS, whichever gets you registered to the GDC, is a must, right? Whatever path you take, ORE and LDS is a must. And after that, whatever qualification you take. And after M-Orth, can we work as consultants? Or like, do we have to spend some like years as a specialist or something?
So the pathway for certain specialties, so for orthodontics and paediatric dentistry in the UK, is that there's a separate consultant exam for both those specialties. The ISCP, not IFCP. Too many acronyms. So, and that's a further. The way that that's trained in the UK is that we then you go on to, it's an extra 2 years of training on top of your specialist training program, but it's not in all specialties. But for orthodontics, if you wanted to be a consultant, you'd have to sit and pass that exam as well. And that is less so clinical knowledge. It's more kind of management, leadership. How do you know how policy works? How does the NHS fit together? If it's, you know, specific to the UK anyway. Because the vision is that when you're a consultant, yes, you will have patients to look after, but you will have a service to run as well, and you'll have all these decision makers making sure, you know, your service is hitting your targets, that all your patients get the best care that they can. So it's kind of hitting not just your clinical knowledge, but all your all-round healthcare leadership kind of stuff. So that's a separate exam for orthodontics and pediatrics that you would have to sit if you wanted to be a consultant within the NHS in the UK.
Within the NHS, yeah. But you can do your private practice as a specialist in ortho. That you can do.
Yeah, that's absolutely fine. Yeah.
Okay, the difference between MFDS and MJDF. You're representing the Edinburgh College. So
well, MFDS is the best, obviously.
Yeah, because the college is the best.
Exactly. I think it's just differences in exams and the way the exams are set a little bit, and also what kind of benefits you get afterwards then when you choose your which you want to be a member of. I chose the Edinburgh College, especially of surgeons, because I knew that I wanted to go down a specialist route. Whereas I saw if you do MJDF, you're a member of the joint dental faculties, it's more a generalist faculty. So if you work in general practice, your membership benefits might benefit you more because you're part of a group of people who are generalists. Whereas now, as the Royal College of Surgeons of Edinburgh, we're part of a cohort of people who are specialists in different areas and are, surgical specialties. And Edinburgh's an awesome city and a great place to go visit. And
college is very friendly too. Yeah.
Exactly. That's sell it to you. Selling it to everyone else who's watching.
Yeah. Okay, so this is done. We've talked about FFD RCS. Like after maxillofacial surgery, what is the FFD RCS?
So after maxillofacial surgery exam. So I'm not a huge. I don't know loads about max facs because that is not my specialty. But you'll have to sit both medicine and dentistry and do. It depends which way round you do it, as in which exams you sit along the way and how long. I think it's quicker if you do medicine first and then do dentistry in the UK. If you've become a fellow which means that you become a specialist, then you'd have to register as a specialist with our General Dental Council here, but also our General Medical Council as well. And in order to then practice as a clinician in the UK, I know you'll have to sit if you want to practice as from the dental point of view. You'll have to sit the ORE or the LDS. I'm not familiar with medical side of things. There might be something that you have to sit medical side, but I don't know. The reason why
the fellowship part, most of this, I know, why the fellowship part matters to them is because they have letters to put after their name, and they don't want to practice in the UK, but they practice in their own countries, and it's like that. It becomes you know how it is. You get the fellowship of the Royal College in that department. So, and I was talking in that regard, people can after maxillofacial surgery, there, especially the Royal College of Surgeons in Ireland, it's offering people such after MFDS, even after they're locally in Pakistan, after FCPS Part 1, they're exempted from the MFDS Part 1, and they can directly take the MFD Part 2. So there was that route, for international dentists. And do you know anything about LDS and the difference between LDS and ORE? Which one is better? Most of the questions are like that. Which one should they take?
I think it's just whichever one you get onto, because I know it's really difficult. As soon as they release the dates for them, that they get booked up so quickly. I don't think there's much. I've heard that the LDS is slightly easier, but that is just hearsay. I don't know if it's actually true. Either is an equivalent. It's not true? No, okay, there you go.
It's not true.
See, this is just rumours that I hear.
Because someone would feel like one exam is easy because he's better prepared for that exam. From what I've heard from people, because it's like whatever you get into and whatever is like easier for you to take. ORE is conducted 2 times in a year, LDS 1 time, so it's like becomes more hard to get into. So, but
you can do both. Can you do both as well?
Yeah. If you have enough money to spend on licensing, then it's a good idea.
It's true. It increases your odds, but then it increases your outgoings in terms of how much it costs.
So I have many recent graduates with me, like who are under like 3 years into graduation. And remember we talked about some dental core training that is being offered in the UK. Could you please like tell these guys about that, what dental core training is and how can new dentists get into that? Also some things about the paid training, where they pay you to train, because most of the people, they want to get paid and then they study, and you know how it is. So it will help especially the international dentists who are like planning to go into UK for dental core training and paid trainings.
Okay, that's fine. I completely understand that. Having my training, I pay for university, but I get paid at the same time, so it's a bit confusing. But it's always nice to be paid to do your training as well, because training is a lot of money. In terms of how training works in the UK, when dentists qualify here, they do 1 year of dental foundation training, and that's for them to work in the NHS primary care. And then following that, so that's working in practice basically. Following that, you could apply to dental core training, but that is also open to dentists who are not UK qualified. And actually, if dentists who are not UK qualified, they can't apply to dental foundation training unless they're a EU graduate. But they could apply for something different called PVLE. Performance validation. Hang on, I wrote it down. I never know all these acronyms stand for when I write them. Performance list validation by experience. And so that was what we used to call vocational training by equivalence. So if you want to work in practice in the UK within the NHS, you have to get something called a performer number, and that number enables you to work in practice performing NHS work. But the only way you could get that was by dental foundation training, or now via PVLE, and that's when you work in practice with smaller targets and you have somebody who's indirectly supervising you, who is your trainer, and that's in primary care. But you can still apply for dental core training without having done PVLE. Dental core training is a training year. There are 3 years of it, but the majority of people maybe do it for 1 year because there's fewer posts once you get beyond the first year. And the idea of that is to give people generally a experience of training, generally in hospital environment, but also sometimes in community, seeing basically patients who are referred to a service for advanced skills. So you'll be doing that 1 year of training alongside consultants, registrars, other highly trained dentists under supervision by yourself, getting an idea how the hospital works. So you could be doing more complicated oral surgery, taking out wisdom teeth. You could be working with patients in theatres. You could be seeing lots of children who are highly anxious. You could be working in maxillofacial departments in A&E, stitching patients' faces up and stuff like that. And that year is a training year which you are paid to do, and you will have somebody there to look after you generally. And that was set up by the NHS in the UK to help people gain experience who might possibly want to go on to further training and to become specialists. So you might have a dental core training year, which is a general post where you might be in a dental hospital and you get an experience of different specialties in the dental hospital, or you could have it in just one specialty in oral surgery where you just learn loads about oral surgery that year. But the good thing is that you're learning, but you're paid to do it.
You're paid to do it, yeah. And you cannot
Yeah,
get into it without ORE or LDS because you still need your like performer number.
Yeah, exactly. So you'll need your GDC registration to be able to apply for any of these. So you have to do the ORE or the LDS to be able to do that.
Okay, so we've done the core training. Now we're looking for the paid training part. Is there any opportunity for us? Like,
there is. I mean, that's what I'm doing. So if you want to go into a paid training pathway, one that isn't through a university, you will have to have done the LDS or the ORE because you need a GDC registration number. So you'll have to go through that. And then depending on the specialty, you'd have to look at what we call the personal specification for each of the specialties, and which can be easily found on the COPDEND website. So COPDEND, and that is the body in the UK who set all postgraduate training curriculums for dentistry and medicine. And they will have, if you look at paediatric dentistry, for example, they will have a list of things that you will have to have, like essential criteria and desirable criteria to apply for certain jobs. So every year, each specialty will have a number of posts come out for paid specialist training in different specialties. And some will have bigger numbers than others. So for example, special care dentistry, my specialty this year across the UK has 5 of those posts. But you look at orthodontics and they have 36, I think. So it depends which specialty you're interested in, and then you have to go through a round of interviews, and it's quite competitive. Some are much more competitive than others, and then you will, if you're successful, you'll be put into a post where you'll be training for, depending on which specialty, 3 to 4 years, where you will be paid. And then at the end of that, you will sit your exit exam, which will be with one of the colleges, or a tricollegiate exam, which some of the specialties do, which are the colleges working together to get your fellowship in that specialty.
That's very helpful. So how hard was it for you to get into special care dentistry?
It was quite hard. It was my second go. It's very normal to not. It's very lucky if you apply once and you get it. Like most people try multiple times and especially because sometimes the jobs that you want, you might be limited of where you want to travel. So because of my personal circumstances, I didn't want to leave anywhere. I didn't want to go up to Scotland to do my training. I wanted to stay in London. So that might limit your choices. It was good numbers though my year. There were 7 posts and they interviewed 14 people. So 50-50 chance.
50-50, huh?
Yeah, but that was lucky, to be honest.
And what are the specialties which do offer the paid training? Because I don't know if restorative dentistry, or are they offering paid training as well?
Yes, but they're very few posts, and the restorative training pathway, it's actually linked with our special care one. We do exactly the same recruitment process and the same interview, but there are, I think last year there was 1 or 2 posts nationally, and that's a 5-year training program because it encompasses all the mono specialties. So it's highly competitive restorative, but all the other ones, even dental pathology, oral maxillofacial radiology, pediatrics as well, oral surgery, ortho, they all have this training pathway, and it's all done nationally under one recruitment portal, where a few years ago it used to be you had to apply to the individual hospitals and centres, but now it's all done centrally, which does make things a little bit more transparent because it's one application you do once a year. If you don't get one.
But are international dentists they prefer it for this paid training post, considering there are so many national applicants? Do you have international dentists working with you in or do you see international dentists and the paid training seats?
No, I don't, to be honest. I work with some international students who are doing the Masters in Special Care, which I'm doing as well, which is the paid, so where they've got scholarships from their own governments and country to come across to do it. In special care, sometimes, and I don't know if in some of the other specialties as well, sometimes the paid pathways via university, the time frames work a bit better. So while my paid training, the government who pay me to do my training, that training pathway is 3 years. If you just did it via university, it's 2 years. So it does make it a bit quicker if you want to get a qualification in the specialism. It just depends which specialty. But I think they find it that international students find it easier to do the paid specialties because you don't have to sit the LDS or the ORE to be able to sit those specialties. And it's nice to, if you do it as a group, whereas I'm a specialist trainee by myself in my unit, and that's fine. But whilst you're at university, there might be a cohort of you, so you might have 2 or 3 of you who are all international students who are all sitting doing the specialty training together. It's a bit less lonely and you can support each other, which I can imagine would be something that you want if you were living in a country that's not your own country. I definitely think I would prefer that than being stuck somewhere by myself in a country I didn't know very well.
So what would you tell, like, because most of the people, even I don't know too much about special care dentistry, is like, is there a consultant position in the UK for it? Because it's a new field, I guess, for specialization, no?
But special care, yes, it's the newest dental specialty in the UK. It was only recognised like 10 years ago as a specialty. And it's basically dealing with patients who have any sort of impairment or disability. So any sort, they might have severe dental phobia, they might have a learning disability, they might have mental health problems. And so it's a growing specialty in the UK. I think because all these patient groups are increasing as well. People are living longer, they're living longer with more medical problems. People who are also, we deal with patients who might be overweight and bariatric and all the comorbidities that come with that, and that is a population group that is increasing. So there are specialist training posts, that one I'm doing, and there are consultant jobs. Not as many as I think there should be, but there are those jobs there. But they are mostly actually in hospitals. And I think most of the patients I see find it really difficult to get to hospitals in the first place. So in my opinion, I think there should be more consultants who work in the community versus who work in a hospital somewhere. But that's just my opinion.
Let's take some questions from the people specifically related to post-graduation in the UK. Okay, what are the opportunities for oral pathology or dental research?
Dental research is a good one we could talk about, because I've talked a lot about how we talked about university type training pathways or NHS funded training pathways. There are also a few academic training pathways for specialties, which are funded by our government's research institutes in healthcare, the NIHR, and they allow you to specialise in one of the dental specialties, and you are paid to do this, but you will also have a set time set aside to do dental research in that specialty, and with the aim that you will be able to get a PhD funding at the end of it. But to do that pathway, you will have to, similar to the pathway I'm on, you have to be a GDC registrant, so you'll have to do ORE and LDS.
So even to apply for PhD, you have to be like registered with the GDC.
If you are doing a clinical PhD where you're practicing, you might have to. If you are sponsored by the university or you're doing a purely research-based PhD, you won't have to. It depends where you're doing your research base, and who is sponsoring you it. So if you're doing clinical work through university, you wouldn't have to be LDS or ORE. But if you are doing any clinical research that's based in the community, which isn't part of a university hub like a hospital, then you will have to because you'll have to have a performer number from our NHS, so you'll have to have sat the LDS or ORE. It's a bit complicated. You can do a non-clinical PhD without being a GDC registrant.
And is the PhD paid one?
To be honest, it depends how you get your funding. If you can get someone to get someone to sponsor your PhD, they will give you a salary. I don't think it's a very big salary, because they cap your PhD salary, but it's better than nothing. But you can also do a self-funded PhD, but that is incredibly expensive. So it depends where you get your funding from, whether that's from your government or maybe one of the research bodies. There are some research bodies in the UK who put out calls every year for people who want to apply for PhD funds. So you have to apply for that, which is quite a long process, I think.
Okay, Natalie, I'll say goodbye to you, and then I'll take Mark again for the international part. Thank you for being with us, and thank you for answering these questions. And stay safe.
No worries.
Okay.
You too. I hope it was useful. Bye, everyone.
Yeah. Bye.
Bye.
Hello again, Mark.
Hello, Haris.
Now let us take the questions from people, because they've been asking constantly so much.
Yeah, let me first
answered many.
Let me first thank Natalie for all these. She
stage is yours, bro.
Lot of questions. Like, thank you, Natalie, for this, and we hope to get use of this next video live sessions.
Yeah, we might do it on Zoom, but I don't know. We have had like good amount of people here with us too. 160 at one point. It's 108 right now.
I guess that the Zoom problem is that it's limited to 40 minutes most of the time if you don't have a code. We can try to find out more. Okay,
let us start with some questions that I already had in my DMs, and then we will move to the questions which they're asking live.
Yeah, sure.
Will studying for FCPS Part 1 help me deal with MFDS exam? No, because FCPS Part 1 is more basic sciences based exam, and most of the questions are like, they're not good questions. They're like who discovered what, and the MFDS exam is clinically based. So all of the questions are clinical questions, which are applied clinical sciences. They are related to what you do in your clinical practice. So no, FCPS Part 1 will not help you deal with MFDS exam. MFDS exam preparation and cost. The cost is like the cost for in Pakistan, I can tell you for Part 1 and Part 2, it's around 4 lakh rupees. You also consider the flight cost, more almost like 80,000 for flights and visa. So in total 5 lakh Pakistani rupees. For Egypt, it must be different. I guess Part 2 is cheaper in Egypt, in Cairo, than Dubai.
So the average cost for the courses, it could be for Part 1 might be 3,000 Egyptian pounds or something like that, and Part 2 maybe 5,000 or 6,000 Egyptian pounds, which is almost like 400 sterling or something, or 300 sterling. Yeah.
So it's asking about the cost. Because it keeps changing and it's on the website for different places. So it's like, it's not something that you would get benefit from us. You can always look at the cost on the website. For Pakistan, I know for a fact that if the test costs like 3,70,000 Part 1 and Part 2, and the flights and courses, you include everything. In total, it's around 5 lakh rupees.
Okay.
Value of MFDS in Gulf. So this is a very common question, and
can I add something, Haris?
Yeah,
So
yeah, sure, sure.
because of
Sure, no problem.
I got the previous question wrongly. So did you mean the exam fees, right? Part one and part two?
Yeah, exam. Yeah,
Okay,
yeah.
so part one is is almost 500 sterling, and part two is almost 1,000 sterling. But the privilege that you have in Egypt, that you don't have to fly to take part one or part two. They are now available in Egypt, because at my time it wasn't available, so you have to add the flight cost and accommodation cost. But now it's available, and also we have preparatory courses conducted by the Royal College itself. We have like 2 or 3 doctors and lecturers from the Royal College who come and conduct this course for 2 days, and actually it's so good and so beneficial for whoever wanna like get like how do they evaluate the candidate and all this stuff. So it's I recommend this course to anyone who wanna take part two.
Visit pyramids and take the course, huh?
Yeah.
We have a center in Pakistan. We have part one conducted in Karachi, but we don't have part two here. And most of the Pakistanis, they go to Dubai for it because it's like cheaper. But it's like, if you can take it in UK, the test in UK is cheaper, but the tickets and stay is expensive. So most people, they want to like take it in Dubai.
Exactly.
About all the different
visa
areas.
Issue.
Yeah, visa issue is also there. And someone's asking about India. There are many centers in India, but you have to like visit their website. There are all the locations listed there for all the countries. It's part one is happening in so many countries, and so is part two. And should I move towards the Gulf part? The value of MFDS in Gulf. I've recently come home from Dubai doing a job there because of MFDS. I have many friends who got a job in Dubai without any specialist degree. And I have many friends there who have MFDS and they're specialists and they're still jobless. So getting a job anywhere, it depends on so many different factors. You must know one thing, like if you're from Pakistan and you're applying for a job in Gulf, especially Dubai, the saturation is too much and it's very hard to get a government job. You will be getting a job in private practice. And what kind of private practice that is depends. Like if that private practice focuses the elite and they want to showcase that our dentists are members of the Royal College, they would certainly prefer you over any specialist. This is what happened with me. I was offered a job at a very elite practice, and there was a perio dentist with me across. There were so many specialists who were applying with me, but the reason they preferred me was I had MFDS and I had some other things also in my CV, but no masters. So they prefer this, like if you have the tag of Royal College with you. Next question is, so like in terms of that, there is value in Gulf, but that value depends on the value that the private practitioner who's hiring you is giving to MFDS. You might get a lot of value, but if everyone is like at one point in some clinics where I applied, everyone had an MFDS. So my MFDS didn't give me any advantage. So it all depends on like your luck and where you're applying. Value of MFDS in Pakistan is, in Pakistan, one very important thing that most of us don't know is like FCPS Part 1 is exempt. It's not easy to get that exemption, but if you have MFDS, you get your FCPS Part 1 exempted and you can directly go into specialist route. FCPS is like our postgraduate programs, like for Mark and all the other people who are not from Pakistan.
Many people are asking for FCPS, and I didn't.
It's like our
But
it's
man, you
our
have some letters in
program.
Pakistan. You have some letters in Pakistan still. You have.
Yeah.
Proud of it.
Yeah. It's like master's program in us, like for a specialist course. And yes, Part 1 is exempt from, but it's not easy to get exemptions. Also, there is a training exemption for 2 years out of the 4 years of FCPS. But that exemption, like that, I'm trying to get that exemption from the PMDC, but like, you know, the situation in Pakistan, the PMDC is suspended. So it's in the, like, it's under process, but like, we might get exemptions for 2 years, and we directly set the IMM and then do 2 years training and then get the FCPS after doing MFDS. But it's still in the pipeline, and it's not like unless and until PMDC starts working again, we can't know for sure. Dr. Sakina from Kenya asks how to become an ambassador for her region, and Dr. Asma from Pakistan asks the same. The Royal College will
the same question here, and many ask the same question here.
Yeah. If you are already a member of the Royal College, you might get an email about the openings for dental ambassadors. Right now, there are openings for ambassadors in the UK, but I don't think there are any openings for the international ambassadors. But when there are, keep an eye on your email, and like you can apply, and like you will be interviewed, and they'll like judge you if you can be an ambassador or not.
Let me add something to this, Harris.
Sure.
You don't just have to be a member, because many members who pass MFDS, they pay once and they don't pay the other years. They just get the title. So you have to be a good standing member, and a good standing member should subscribe and pay the subscription fees yearly in a regular way. So he can, when he apply for the ambassador post, he has more points than those who didn't pay they paid only for the first time.
And you have to be a very active and good dentist as well as Dr. Mark.
Harris.
Because they don't choose anyone easily, but like you have to apply for it.
Yeah.
MFDS Part 1, Part 2 preparation, which diploma? Okay, if you have done MJDF Part 1 and MFDS Part 2, you are awarded with MFDS Part 2. Whatever Part 2 you do, you get that diploma. And yes, MJDF Part 1 is still valid for MFDS Part 2. And yes, MJDF might be changed to MFDS, but like it still be the MFDS of the Royal College of England, and this MFDS is MFDS of the Royal College of Edinburgh.
Yeah, you have just when you apply for the exam, you just have to make sure which Royal College you are applying in, like, because the exam as saying that the exam title is gonna be changed for the Royal College of England. So it's not gonna be anymore MJDF, it's gonna be MFDS also. So you have to make sure
I don't know if it's already done.
But
it's in the pipeline, I guess. Corona, I think it postponed everything for the whole world. Huh? Nothing's happening now.
But actually, they started changing the names on their official website. They started doing this, and it's still a bit confusing.
Okay, I'm done with questions here. Let's take the live questions. Okay. Is MFDS Part 1 exempted for FCPS people? I don't know about MFDS. MFD Part 1 is exempted because they have FCPS, CPSP and the Royal College of Ireland, they have a deal with each other. So yes, you can take MFD Part 2 directly after FCPS Part 1. So preparation book. Let's see if I can. How do I pin a comment? Oh my God, it's lost.
You're an expert, Harris. You know how to do it.
It's not working right now. Okay.
You taught me everything on Instagram, you know.
Okay, let me tell you guys a bit about preparation. Go to www.helpingdentist.com. I've written a small guideline, and I've listed some books that you have to study. It's for MJDF Part 1. The same applies for MFDS Part 1. The books are the same, and past papers you can get from Facebook groups. We have different courses for both MFDS Part 1, MJDF Part 1, both in Egypt and in Pakistan. For people from Karachi, there's an organization called the Dental Lounge. They offer very good courses. Dr. Maliha teaches them. For Lahore, we are like trying to start a course, and I don't know of any good courses that are for MFDS Part 1, but that website would suffice. I guess for Part 1, you don't have to spend a lot of money. How can MFDS help after FCPS? Well, FCPS is a different, like, to be honest, if I talk about specialist training in Pakistan, there is no specialist dentistry in Pakistan. I don't know about Egypt, but like there is no such thing as specialist practice. Every dental clinic is a multi-specialty center, and every dental clinic has a orthodontist, a periodontist, a prosthodontist. They have everyone, every like faculty, and you don't necessarily refer any case to a specialist. So specialist practice is like non-existent in Pakistan. So I don't know if you take this specialist route seriously in Pakistan, but like if you are a specialist, you are also a member of the Royal College, you get some fellowship, you have letters with your name, and you can practice your, like, you can build your private practice with it in Pakistan. For the postgraduate options in the UK, there are many options that you can do, and you can like pursue those options, improve your knowledge, because in my opinion, specialist practice should only be to improve your knowledge and practice that specialty. It should not be to be like spend so much time and money only to run your private practice. So if you're only after running a private practice, MFDS is like the cheapest investment that you can do.
Yes, totally agree with you, Harris.
Thank you, Alex. I have this. If I do FCPS 1, will it exempt MFDS 1? No, but it will exempt MFD 1, which is the membership exam of the Royal College of Ireland. Where are all the questions now? Which one is good? Sorry.
Someone is asking what's the difference between England and Edinburgh Royal College, I guess. The type of the exam, like part 2 is different. Like the England, yeah, the England Royal College has another way of examination that you can check their website. They have like four something domains that they set the exam on, different than the 10 station OSCE for the Edinburgh Royal College. So I guess, yeah, they are different, but at the end you have, if you take the second part from the Royal College of England, you will not be able to get the benefits from the Edinburgh Royal College, right, Harris?
No, because also like you have so many international dental ambassadors to guide you, and it's like Edinburgh is like the oldest college and more spread out all over the world. Let me tell you something. Even if you're looking for a postgraduate option at New York University, and you're going after, like, for example, oral surgery, they have an FFD program in oral surgery. MFDS exempts you. Like, you either take NVDE part 1 and part 2 or MFD part 1 and part 2. So it's like there are so many options in different countries. For Egypt, Mark can tell you, like, what does MFDS do for post-graduation?
Yeah, okay. So
it's like amazing. Like, all the Pakistanis should get ready to book their flights for Egypt if they've done MFDS.
Yeah, they are so welcome, but maybe after the outbreak that we have now.
yeah.
But many things that you can get while you're in Egypt. First, as I told you, you just feel this self-confidence to start your private practice. Other than this, when for me, I will tell you what happened with me after I finished the MFDS exam part 2. Because I'm teaching in a university, I have to start an academic pathway, and I have to prepare a master's degree. So when I was applying I was applying in a university called Ain Shams University. Each university has its own rules. So I was luckily exempted from many subjects. In the first year, we have 4 semesters. So semester 1 and semester 2, I had to study only 2 or 3 subjects out of 10 subjects, which was something like perfect for me. And it's
a big thing, yeah. You don't have to study a lot.
Yeah, and other specialties, they might exempt you from the whole first and second semesters. So this is regarding the master's degree. But as you said, like, people are looking for letters, and when they know that you are a member of the Royal College, you give some credibility for the patient and for building your patient base. And when sorry, continue. Yeah, and also when you apply for, like, when I was applying for a teaching post, it helped me that because it was on the CV, so it helped me that I'm I'm pointed out from others, like they say like this one has an MFDS and a Royal College member, so he might be the first other than others, you know. So it really sounds great to have to be a member of the Royal College in Egypt.
After completing MFDS Part 1, do we need some training from our country or UK before appearing in Part 2? For Pakistanis, yes, house job, the 1-year training, the compulsory internship in other countries, 12 months training that you need. Thank you, Dr. Shoaib. Exemption for NBD Part 1, Part 2. Not that I know of, and I know some people who have completed the NBD Part 1 and Part 2 and they're still doing ORE. It's always a good idea to call the GDC, and they always provide you with some sort of like tips and tricks and loopholes. But in my knowledge, there is no exemption for NBD Part 1 or Part 2. Please tell me the difference in fellowship and membership. So it's like a member is daddy and a fellow is a big daddy. It's like that, because as a member you're just entering the Royal College. You're just a young person, or even if you're not young, it's like you're entering the field. A fellow is someone who has spent a certain amount of time. So it's just like a fellow is a bigger thing than a member. We all aspire to become fellows one day, and it's not that easy to get a fellowship. You either have to do some specialist training for 3-4 years, or like you have to be assessed by the Royal College to be awarded a fellowship. MFDS Part 2 is about OSCE-based questions. Yes, MFDS Part 2 is about OSCE-based questions. Okay.
I guess we lost the questions from the first live, right?
Yeah, we have lost those questions. And I don't know if the same people are here with us. MFDS benefits over NBDE. Look, NBDE is a licensing exam if you want to enter the US. Like if you're entering the US, you have to take the NBD. MFDS is not a licensing exam. MFDS is a membership exam of the Royal College of Surgeons of Edinburgh. Now we have MFDS future in Pakistan. MFDS, in what sense? Like you have more knowledge, you can add letters in your private practice, you can get your training like FCPS Part 1 exempted. There is no official regard. PMDC gives you a 2A, like you can work as a registrar, but as I said, the training exemption is in pipeline. It's not decided yet. So I don't know why you want to ask about the value in Pakistan. If you don't know why you're doing this exam, there needs to be a reason to take. Like if you are going after some credibility or like letters after your name, then sure, take it. It will help you in private practice. Please repost the name of that website. Give me some time, guys. Let me see if I can.
There's a question, Haris, that's saying, does MFDS also help passing ORE? I guess yes, MFDS gives you the baseline of the UK guidelines and the way that they are asking and the clinical experience that you get and knowledge that you get from studying and preparing for MFDS. It gives you a lot of knowledge and being easier to prepare for the ORE. This is what I heard from many.
And it's better to take both the exams together because your knowledge is fresh and it's like more or less the syllabus is same. ORE has more of basic sciences. And when you take both the exams together, you shorten your time to get into UK. How does the preparation? How can we apply? You can go to the website and fill out the registration form. You only need a BDS degree. You don't need IELTS or anything for this exam. So it's not that difficult. You just need an attested degree. You send it by mail. I don't know, you can scan it and send it. Pay the fees.
Yeah.
How does the preparation differ if you are giving MFD Part 1 and Part 2 both instead of Part 2? I don't understand that question. I guess he's asking whether for MFDS, I know for a fact that both of the exams have similar preparation. Part 2 is like clinical based, so it's more like practicing and performing. Part 1 is like more of knowledge based. You have to know all the things. So like you can prepare for both parts together, but for part 2, you also have to practice what to say, how to say. What is good to go with MJDF for MFDS part 1? However, part 2. I took part 1 MJDF and then part 2 MFDS because MJDF part 1 was being conducted in Lahore. So that was easier for me. But it all depends on you whether you want to take MJDF part 1 or MFDS part 1. Okay, which is better for a specialist approach? For being a specialist in what subject? MFDS is just an entry-level exam for all the specialties. It used to be essential to do MFDS and no specialty would take you. It was a requirement. Now it's not a requirement, but it's desirable. So like if you want to pursue any specialty in the UK, MFDS is like very important. Do you need to do training in UK after passing MFDS Part 1? No, you don't. Is MFDS Part 1 conducted in Pakistan? Yes, in Karachi. For Mark, how can we get fellowship by living in Gulf country after MFDS?
Okay, so to get a fellowship, you have to first get a membership to be a member. Right, Harris?
Yeah. Without MFDS, it's not.
So by living in Gulf, I guess you have to first apply or sit an examination for a specialty program to be a specialized member, not just a general practitioner member like MFDS. So you have to apply for, let's say, M.Endo exam. So you have to show a document that says you have been practicing endo in a certain institution or hospital and have taken a training for 3 years, and you have to have a logbook, and you just go to the regulations for the membership in the website, and you should know everything. You should all the documents you need to apply for this membership examination, and then you have to get prepared for the exam and pay for this and travel and get the exam. After you pass, now you're a member. And then I guess after being a member with few years, you can be a consultant. It's according to the country you're working in. You have to go back to the regulation of the country.
After clearing MFDS?
Yeah, in Egypt, we after finishing the membership exam, the specialty exam, you can be a consultant from the syndicate. It certifies you as a consultant after 2 years of practicing.
For UK, I guess after 5 years you need 2 years for consultancy, but some can become a consultant directly.
But maybe after finishing the exam, like after the program.
After finishing the exam, after becoming a specialist,
Yeah.
How does MFDS help me work in the UK? Should I do ORE first or MFDS? Okay, MFDS is not a licensing exam. It is important to get into private practice or get better jobs in the UK. So it helps you get better jobs. You should do both together. If you're just looking to enter get registered with the GDC, you should do ORE first. No, you cannot practice in the UK after passing MFDS. You need to do ORE and LDS. The prep for MFD part 2 is same as that of MFDS. In my knowledge, yes, but the exams are different. But I don't know much about MFD part 2, which is the exam for the Ireland Royal College. But yes, the preparation was more or less same. For private practice in Pakistan, which post-graduation is better? For private practice in Pakistan, you need to be a better practitioner. You need to know how to market your practice, and no post-graduation is better. If you are not a good private practitioner, it's a business. You need to be a good businessman to be a good private practitioner. We are getting a lot of questions.
Yeah, there's a
MFD
question which
versus
is important,
MFDS. Okay, address it.
which is is IELTS needed for MFDS Part 1? No, it's not.
Yeah, IELTS is not required. You don't need IELTS.
Yeah, and many answered this question, by the way. I just
Yeah. Which is better, MFDS or MFD? MFDS because you become a member of the Royal College of Surgeons of Edinburgh. Of course, we are biased, but like MFDS is more global. But it all depends on what you want in future. All of these MFDS, MFD, and MJDF, which will be MFDS now. All these are interchangeable, so it doesn't matter. The benefits most offer are like interchangeable. Can we do MFDS Part 1 before house job? Yes, we can. For Part 2, we would need house job though.
There's a question of what advantage does clearing MFDS have over MOrtho? No, so MFDS is a general. If you are a general practitioner and you want to have a better qualification and be like spotlighted other than general practitioner, you take the MFDS. But MOrtho is a specialty program that you have to take like 3 years and then have a specialty exam, and you then be a specialist, not a general practitioner.
Yes, Alex, there is no maxillofacial specialist program in the UK, but the Royal College does offer a membership in the oral and maxillofacial surgery, which is for the international dentists, and it has the same standards as there are for all the other memberships. But you cannot practice as a maxillofacial surgeon without a medicine degree. Yes, MJDF is still being conducted in law, and I don't know a post-corona situation, but it is. ORE and LDS is an endless debate. I would say yes, Furkan, you are very right. Whichever you get into, take that exam. It's not that different. Can we go to UK as hygienist after BDS and then clear ORE to work as a dentist? Yes, you can. If you get a work visa, that would be perfect. Hygienist earn good amount of money there.
What? Okay.
Fellowship pathway in general dentistry. Well, it's a long process. They are like introducing new fields. There's a recent what was it? MAGDS, membership in advanced general dentistry. It's recent and not too much is known about it, but yeah, there is that.
But you have to work in UK to get the benefit of this. Like if you get it and you're still working outside UK, I don't think you.
Yes, there is no benefit outside. MFDS would suffice.
Yeah.
Will you recommend FCPS Part 1? Depends on what you want. I would not recommend it for private practice. Honorary fellowship. You can get honorary fellowship if you win a Nobel Prize or you're very famous or you've done so much in dentistry. But it's very hard to get honorary. It's like
Harris is so close to this.
No, I'm not that close to it. Fellowship pathway in maxillofacial surgery. Okay, guys, I have been getting a lot of questions related to fellowship in maxillofacial surgery. Do you want to practice in the UK? Then you need a medical degree. You cannot practice maxillofacial surgery in the UK. There is oral surgery, and you can do oral surgery, but there is no such thing as maxillofacial surgery after BDS in the UK. No, you don't need to clear ORE before getting into MOrtho, but you need ORE to practice as an orthodontist in the UK. Yes, it's very hard to get a visa as a hygienist, but it is particularly important for people who are already in the UK on spouse visa, and they are like applying for ORE and LDS. They can, in the meantime, get a hygienist license and work as a hygienist. I know some of my friends who are doing this right now, and they're earning good money. I guess they're earning more than they would get from NHS. Okay, so final 5 minutes questions. How do we go to UK to get fellowship exam? First, apply for membership. You need to have a training. From that training, you can apply for a fellowship exam, and you can get fellowship just for post-nominal letters. Okay, If I'm a UK passport holder, do you still have to give ORE? Yes, to get registered from GDC, you need a GDC recognized degree or you need ORE. Exemption of FCPS Part 1 and 2 year of residency is in pipeline or being applied. The exemption of Part 1 is applicable, but it's a long process. The 2 year of residency is in pipeline. It's not yet a thing. For oral surgery, both are the pathways of different Royal Colleges. You have to take the exam. No, MFDS does not make it easy to prepare for MProsto, but MFDS is like the baseline exam, and people consider whoever is taking MProsto, they consider you up to the level of the qualification of MFDS, but you don't have to take MFDS for MProsto. How much does training cost in the UK? It costs a lot. A lot. You have to look at the websites for different programs, but it's not cheap. Do we need to give FCPS Part 1 after clearing MFDS? FCPS Part 1 is exempt, but to get that exemption is not easy. It takes time. How can a middle-class Pakistani settle in the UK? Well, you need money, like to and to generate that Pakistan, you can do private practice. I mean, it all depends on how you manage your career and why you want to work in the UK. In my opinion, if you're going to work in UK, the best way is to take both the MFDS exam and the ORE together. By that, you have become a member of a prestigious college, and you can then apply for a post-graduation, and ORE gives you the license to practice. MFDS suggests rest. No, you don't have to study basic sciences for MFDS. There will be questions related to basic sciences only. You need to study basic. They're just being like safe legally. I've already booked MFDS Part 1 with England. Can I do part? Yes, you can do Part 2 with Edinburgh. Yes, we can prepare for MFDS Part 1 and LDS Part 1 simultaneously. It's not the same, preparation is not the same, but you can prepare it simultaneously. My experience about the DHA, I've also mentioned the walkthrough guide about DHA, which is the exam for licensing in Dubai, in my comments, one of the pinned comments, helpingdentist.com. DHA is a very easy exam, and most of the questions are repeated. So it's like you need only a month to prepare for it, and after passing your exam, you can practice if you get a job there. Kindly answer FKAM question. What is the question? I don't know what that question. Yes, I have answered it. You can be registered as a specialist, but you can only practice oral surgery, and that practice is limited. Usually these letters are for people who are not practicing in the UK. Like they provide more benefit to those people. You only need a BDS degree to apply for MFDS Part 1. ORE and MJDF Part 1, the preparation is a little different. For ORE, you have to do some of the basic sciences as well. Okay, guys, it's time for me to say goodbye. Okay, is it easy to get a job for BDS after MFDS in Saudi? As far as I know, getting a job in Saudi is becoming more and more difficult because they are preferring locals. So it might become easier if some employer prefers it, but I don't know much about it. FRCS for specialist endodontists. For endo, there is an exam, membership in endodontists, M-Endo, and that requires 3 years of formal training. You can look at the website for the requirements. After that exam, you apply for the fellowship later on. It was very nice talking to you guys. Inshallah, I'll be back some other time to talk about it. You're most welcome. And it's time for me to say goodbye. Allah Hafiz. Stay safe, stay at home.